In this module, I'd like to talk about severe Alzheimer's disease. These patients, of course, are compromised much more than those in earlier phases of the illness. They are more dependent on others for their care. They're more likely to be in residential settings. They're more likely to be behaviorally disturbed. Basic bodily functions such as continence and eating and dressing are more affected in this group of patients than in others. Donepezil is a cholinesterase inhibitor that is indicated for the treatment of severe disease. This was an interesting observation because until the late-stage patients were studied, we weren't sure that there was enough cholinesterase available for cholinesterase inhibition to be pharmacologically meaningful. What we see in the studies of patients with severe disease is that Donepezil, which is the only cholinesterase inhibitor indicated for severe disease, is able to produce an improvement in both cognition and global function. It is also able to stabilize the deterioration in activities of daily living. In most of the studies, no effect on behavior was seen. Similarly, memantine is also indicated for patients with moderate to severe disease and similarly produces an improvement or stabilization in measures of cognition, global function, activities of daily living, and behavior. Most patients with Alzheimer's disease are treated with a cholinesterase inhibitor, and as they enter the moderate to severe stages or as they experience decline in spite of cholinesterase inhibitor therapy, memantine is added as a second drug. Most patients with moderate to severe disease then would be on combination therapy with a cholinesterase inhibitor and memantine. Even severe patients appear to tolerate this combination well with no excess of side effects. Have we optimized therapy with cholinesterase inhibitors? This is an interesting question which is being assessed in studies of high-dose Donepezil. Studies show that brain inhibition of acetylcholinesterase is suboptimal when we're using the current 10 milligram dose per day. A clinical trial has been initiated and completed investigating the higher doses of Donepezil to determine whether this provides added benefit in terms of function and cognition for the patient. We're looking forward to the results of this important clinical trial.